Good morning, everybody. Welcome to my channel, Oral Pathology Made Easy. This channel was started with the prime motto to help the undergraduate dental students in understanding and learning oral pathology. We have also started two blogs. In one blog, we'll be discussing MCQs and Viva questions pertaining to oral pathology, and in the other blog, we'll be sharing our notes for the undergraduate students. So, the first lecture of our channel is on the developmental disturbances of teeth. So, before we understand the developmental disturbances of teeth, it is important to understand the developmental stages of teeth. The developmental stages of teeth include initiation, proliferation, histodifferentiation, morphodifferentiation, apposition, and calcification. There could be either deficient development in this stage or there could be excessive development in this stage. If there's deficient development in initiation, it could lead to anodontia, and if there's excessive initiation, it could lead to supernumerary teeth. If there's deficient histodifferentiation, it could lead to amelogenesis imperfecta of hypoplastic type, dentinogenesis imperfecta. If there's deficient differentiation, it could lead to peg lateral, mulberry molar, microdontia. And if there's excessive morphodifferentiation, it leads to cusp of Carabelli, macrodontia, taurodontism, dense dentary. And if there's deficient apposition, it could lead to enamel hypoplasia, dentinal dysplasia. And if there's excessive apposition, it could lead to enamel pearl hypercementosis. If there's deficient calcification, it leads to amelogenesis imperfecta of hypocalcific type. And if there's excessive calcification, it leads to sclerotic dentine. So developmental disturbances of teeth, they can be classified according to the number of teeth, size of teeth, shape of teeth, structure of teeth, growth of teeth. So in this lecture, we'll be just covering about the number of teeth and size of teeth, and the remaining topics we can cover in the upcoming lectures. So coming to the developmental disturbances pertaining to the number of teeth, first comes anodontia. As the name indicates, there's absence of teeth. Anodontia can be of three types: true anodontia, induced or false anodontia, pseudoanodontia. So true anodontia refers to the congenital absence of teeth. It can be either total true anodontia or partial anodontia. And induced or false anodontia refers to the condition which happens as a result of extraction of teeth. So there's no absence of teeth as such. There's due to the developmental defect, it is just because of the extraction there's absence of teeth. So this condition is called induced or false anodontia. And there's another condition called the pseudoanodontia. When there's multiple unerupted or impacted teeth, there's presence of teeth actually in actual, but it is not erupted, it is impacted, leading to a condition which looks like anodontia clinically. So this condition is called a pseudoanodontia. So coming to total anodontia, it is a very rare condition where all the teeth are missing. Sometimes it can involve both deciduous and permanent dentition, and it is associated with hereditary ectodermal dysplasia. So coming to partial anodontia, you can classify that as hypodontia or oligodontia. Hypodontia refers to the lack of development of one or more teeth. Oligodontia refers to the lack of development of six or more teeth. So considering these terminologies, we can understand that oligodontia is a type of hypodontia. To summarize the same point, hypodontia refers to the lack of development of one or more teeth. Oligodontia refers to the lack of development of six or more teeth. So, uh, it can commonly involve one teeth or more teeth, and any teeth can be congenitally missing. This is a clinical picture where you can see multiple missing teeth. So this is a clinical picture of partial anodontia. So coming to true partial anodontia, there could be varied etiology, uh, which can range from familial tendency. Most commonly, autosomal dominant pattern is seen, and missing third molar, that is the most commonly clinically missing teeth, and it is sometimes associated with hereditary ectodermal dysplasia. And in some conditions, when X-ray exposure during the early stages can lead to the defect in the development of the tooth bud, which can further lead to anodontia in future. And the frequently involved teeth include third molars, as I had mentioned earlier. Next comes the lateral incisors, maxillary and mandibular second premolars. This point is very important in terms of MCQ and for the NEET preparation. Sometimes bilateral involvement is also seen. So this is a radiographic picture where we can see multiple missing teeth. So coming to true partial anodontia, in severe partial anodontia, there is bilateral absence of teeth. In this can be also seen in hereditary ectodermal dysplasia. Apart from the missing teeth, you can also see deformed or crown-shaped teeth. So congenitally missing deciduous teeth is generally uncommon. Generally, permanent teeth is congenitally missing, and usually laterals, mandibular laterals, and mandibular cuspids are also seen. So syndromes associated with the anodontia include ankylosing superior, Cruzon syndrome, Brown syndrome, ectodermal dysplasia, Ehlers-Danlos syndrome, Hurler syndrome, Sturge-Weber syndrome, Turner syndrome, in incontinentia pigmenti, Ellis-von-Crevaux syndrome. So coming to hyperdontia, it refers to the development of increased number of teeth, and the additional teeth are termed as supernumerary teeth. So supernumerary teeth, they resemble the normal teeth like molars, premolars, and the incisors. So this is a picture of a supernumerary teeth. So, supernumerary teeth can develop from the third tooth bud arising from the dental lamina near the permanent tooth bud. It can also arise from the splitting of the permanent tooth bud itself, and there could be hereditary tendency. Multiple supernumerary teeth are seen in conditions like cleidocranial dysplasia, Gardner syndrome, where you can find multiple impacted supernumerary teeth. So, when you identify a patient with multiple impacted supernumerary teeth, you can suspect Gardner syndrome, because Gardner syndrome patients have a high malignant transformation rate of intestinal polyps. So, oral cavity plays a major role in diagnosing Gardner syndrome at a very early stage. And mostly supernumerary teeth are impacted, as I had mentioned. It can be found in any location, but 90% of the cases reported are in maxilla. So coming to mesodens, this is the most common supernumerary tooth. It is situated between two central incisors. So this is a clinical picture of mesodens, where you see a conical shaped tooth-like structure in between the two incisors, central incisors. This is the radiographic picture. You can also see a small conical shaped root, which is comparatively smaller than the actual size of the root. So high incidence have been reported in the Caucasian population with 2:1, and there's a transmission of through autosomal dominant trait. Coming to fourth molar, this is the second most common supernumerary teeth. It is situated distal to third molar. It is usually small in size, and maxillary fourth molars are more common than the mandibular fourth molars. Accessory fourth molar is also called by the name distomolar or distodens. So this is a radiographic picture of a distomolar. So other supernumerary teeth include maxillary paramolars, mandibular premolars, and maxillary lateral incisors. So paramolars, they are a supernumerary molar which is mostly situated buccally or lingually to one of the maxillary molars interproximally between the first and the second molars, or interproximally between the second and the third molars. They are small and rudimentary. Coming to the developmental disturbances associated with the size of the teeth, first comes microdontia. So, as the name indicates, microdontia is micro refers to small and dontia refers to teeth. So, it refers to small teeth. So, the in such conditions, the teeth are smaller than the usual size. It can be of three types: true generalized, relative generalized, and involving a single tooth. So, coming to true generalized, all teeth are smaller than normal, and this condition is extremely rare. You can see such conditions in pituitary dwarfism and Down syndrome. And relative generalized type, here, the teeth size might be normal or slightly smaller than usual, but the jaw size is excessively large, which gives an impression that the teeth is smaller. So this happens when inheritance of teeth size is from one parent and inheritance of jaw size from the other parent. So in clinically, microdontia can be seen through excessive spacing. Microdontia involving single tooth is also called by the name localized microdontia. It is very common. The most common teeth affected include maxillary lateral incisor and third molars, and it can be seen in facial hemiatrophy. So coming to my peg laterals, this is the most common form of microdontia. The mesial and distal surfaces of the lateral incisor taper, forming a peg-shaped or cone-shaped crown. The roots are also shorter than normal. This is a clinical picture of a peg lateral where you can see a conical shaped crown where the mesial and the distal surfaces of the lateral incisors taper, forming a conical shape of crown. And coming to macrodontia, it refers to the teeth which are larger than normal. The synonyms include megalodontia and megadontia. There are three types similar to microdontia, which include true generalized macrodontia, relative generalized macrodontia, and macrodontia of single teeth. True generalized macrodontia is extremely rare, and all the teeth are larger than normal. It is associated with pituitary gigantism. And relatively generalized type, as I had mentioned earlier, the size of the teeth is usually slightly bigger or normal, but the size of the jaw is small. Because of that, it gives an impression that the teeth are bigger. So, as I mentioned earlier, to relative generalized microdontia, this happens when the teeth size is inherited from one parent and the jaw size is inherited from the other parent. And coming to involving a single crown, uh, single tooth, this is also quite uncommon. Um, this can be seen in facial hypertrophy. This is a clinical picture of macrodontia. So, this is the end of today's session. So, we'll be covering up the developmental anomalies of shape of teeth in the upcoming lecture. So, thank you for your patient listening. Please drop your comments in the comment section and